Well, let's get more on this now with Dr. Amit Thakker in Nairobi. He's the chairperson for the Africa Healthcare Federation. Really good to have you with us, Doctor. Now, this resurgence of cholera has been classified as a grade 3 emergency by the WHO, with Southern Africa among those hardest hit. Why is that region being particularly susceptible at this point?
Thank you for having me. That region particularly is susceptible because we've been talking about when you have a very densely populated area coupled with poor sanitation, it gives a very good breeding ground for cholera. Lusaka, for example, is one such example of this. This is why the president of Zambia is also encouraging the people to move out to the villages, because the infrastructure and sanitation cannot cope with the huge demand and influx, leading to poor supplies, poor water supplies, and therefore easy transmission of cholera. That is the real underpinning of why we've seen this outbreak.
There's been a little good news with the World Health Organization announcing the shipment of oral cholera vaccine. Is it a case of being a little too late at this point, or can an injection of this much needed vaccine stamp out this outbreak, not only in Zambia, but also in neighbouring Zimbabwe?
Absolutely. It's actually not too late. Let me tell you that the way this Vibrio cholera, the bacterium, starts spreading, you actually have this vaccine protecting the spread. The case fatality rate is 4%, and it's pretty high. Out of every 100 cases in Zambia, 4 are facing fatal situations. So obviously, there are many being discharged from hospital, but you can see how overcongested everything is. And so these vaccines are absolutely a welcome step by WHO that will protect Zambia, and also cross-border transmission to the neighboring countries, which have heightened surveillance.
Now, in 2023, it was reported that there'd been a surge in cholera cases worldwide, and the WHO is saying there's been a dire shortage of this vaccine. Is that still the case in 2024?
It is still the case, unfortunately. You remember when we had the COVID pandemic, everybody repositioned their priorities on what they would manufacture and what kind of supply chains would be put in place, focusing on more important and priority vaccines. The president, at my last visit in Zambia in October, also welcomed WHO and the stakeholders to set up a vaccine plant in Zambia, and he clearly mentioned about cholera before this outbreak did set in place. So we need Africa also to start manufacturing its own vaccines on conditions that affect Africa more than others. And the time is now.
Okay, Dr. Amit Thakker, we will have to leave it there, but best of luck with your work in combating this outbreak, and thank you so much for joining us on TRT World.
Thank you so much.